to $150,000. The town also has to calculate, which I have been told by the town administrator, a $30,000 penalty. How did he arrive at this figure? You must know the age of every person and their spouse in order to calculate. However, the town administrator refused to give me that information. So I will give you an example. If a person is 75 and he is being moved over, he has a penalty of 10% each year. So you must multiply 10 times 10, and it comes out to 100%. So the individual pays still the $110. However, the town also has to pay $110 penalty per month. This penalty is figured every year until that person dies. Remember, if a person does not qualify for Social Security, but the spouse does, then both are forced onto Medicare Med-Ex. $2,000 increase is not a modest burden, but definitely a financial hardship if your income is only $15,000. Switching over to Medicare with no co-pays, like they have said, we would need to go to a doctor 133 times a year in order to make up that $2,000. To save money, we are attacking the most vulnerable. They paid their dues when they worked. Now the town wants to break the agreement. What happened to the saying, your word is your bond? Do we really want to save money on the backs of the elderly? Some of the people are in their 80s and 90s. I personally know 3 in their 90s. One is blind, one has Alzheimer's, and the other one is the husband of the wife who has Alzheimer's. I personally think that we need to figure this out. They could be your parents or your grandparents. Yes, every generation is supposed to take care of their elderly. I have lived in North Reading for over 40 years. And if this article passes, it will be the first time that I am ashamed of our town. Thank you for listening to me.
Kirby.
I'd actually like to address just a couple of the comments that were made in the prior presentation. I'm actually not going to get into a point-by-point rebuttal on things. A fair amount of what was said is actually correct. I think I would ask folks to emphasize and understand the context of the times that we're in. And when you define modest, I think that obviously modest is in the eye of the beholder. $2,000 is, or we believe it's actually below $2,000, but it's probably in the $1,500 range, so we acknowledge that. That is in the eye of the beholder as well. We are talking about, folks, an alternative because we're headed into FY12 of significant layoffs. I'm not saying that officially. I believe if you look at it personally, if you look at the expiration of stimulus funding and other structural deficits that part of the Finance Committee has spoken about this evening, I personally don't see a way to avoid that. Maybe there is, but I think there's a legitimate possibility of that. $150,000 is not going to solve that problem, but it frankly may well be 2 or 3 positions, and it may well be a livelihood of 2 or 3 people. That's also not modest. So those are the realities, the choices that we're dealing with this evening. I don't take any pleasure in talking about this. I think this is a lousy choice for all of us, but we have to deal with what are the responsible things to do. I would like to emphasize the point that Mr. Keller made previously. We are talking about asking 10% of the people that are being impacted by this to accept the same level of benefits that are already offered to 90%. This is not an outlier. We're not, as Mr. Keller adoption of this article. There's a couple of factual points though I do want to make. There was a comment about the number of impacted people. There actually are a couple of a small number of spouses that are impacted. The majority of the people we're talking about are actually on single plans, so I think it's a little bit of an overstatement to overemphasize the number of people impacted. The penalty that was referenced is actually already been netted out of the savings estimates that we've presented. It's actually going to be the financial obligation of the town to pay any penalty, if any. That's not going to be passed on to the retirees that are impacted. There are state assistance programs that are available for elderly senior citizens that are unable to, that do not have the financial resources to pay the Medicare Part B premiums. There's also, depending on criteria, state assistance programs that are available to pay for medics premiums. Again, there are definite criteria. I'm not trying to minimize that, but we're not, in our view, leaving a situation completely unaddressed. And I do have to take exception to the term that we're attacking people. At least in my view, we're not trying to attack anybody. We're trying to make the best of some really, frankly, lousy alternatives. And we're trying to do so in a way that we feel is financially prudent for this budget, as well as for subsequent years' budgets. I want to make sure everyone understands the $37 million that we're talking about for unfunded liabilities. That's basically amounts of money that if we don't take steps to address, will be breaking promises potentially on an even bigger scale going forward, because we're simply not going to have the wherewithal to deal with that. One other point I would make is if you look at what the cost impact to the town would be, if the 90% were enjoying the same benefits as the 10, we would actually be having over $1 million in annual added expense that would be in the employee benefit line. We're trying to basically capitalize on federal benefits that we've already paid for. It's not often we have alternatives where someone else is willing and actually obligated to pay for things. Usually we're here talking about things where is the school doing this, or is the town doing that, or is the tax rate doing this? And it's a zero-sum game amongst all of us. This is about making Medicare pay the appropriate amount that we're entitled to in a way that we believe is ultimately responsible. It's not painless, but it's best in our view of a number of very lousy alternatives.
Mr. Brown. Daniel Road, 61 Adams Street. I'm a retired town employee. I worked for the town for 37 years. I was involved when we first changed the insurance program to the retirees. This was when we had a personnel board. This was before unions, negotiations, or anything. The purpose was, at the time that people retired from the town, they paid the full insurance premium. And the point made at that meeting was that when a person retires, he does not need to pick up additional costs. Now, by the town's figures, they're telling me, for me and my wife, it's going to cost me an additional $36,something a year. And they're saving $4 million. Well, if that's all it's going to cost me, what I would like the town to do is assure me that they'll pay for that, there'll be no additional cost, and anything that Medicare doesn't cover, that my insurance covers now, they'll pick up the additional cost of that. If they're willing to do that, then I would say fine. We have tried repeatedly to sit down and negotiate insurances with the town. They have basically refused to do it because they're in mine. We have had insurance people come in and have said, we can sit down and negotiate a total insurance package for present employees and retired employees. And the town will not do that. I think this is a disgrace.
Donald Cook, Wadsworth Road. I too am a member of the Insurance Advisory Committee. I have been for about 4 years. And I've had many conversations through that board with retirees. And I just want to address one point of the FinCom's presentation, that they keep alluding to the 90% that have elected to take Medicare over the town's plan. I just want to let you know that many of those retirees have told me that they were misinformed and were told that they had to go on Medicare. They could not continue with the town's insurance. Okay, that's a totally unfair situation. And to use that 90% figure come up with names for you of people that will testify that they were not told that they had the option to stay in the town's insurance. So it was not of their own volition. Thank you. Mr. Vino.
Good evening, Mr. Moderator, Town Meeting. Joe Vino, 11 Rock Street, former member of the Board of Selectmen. I stand here in opposition to this article for a number of reasons. The first one is, one of the things we heard from the Finance Committee is all employees are paying this tax. That's not true. It's all employees after 1986 are paying this tax. Anyone before 1986 is not paying this tax. So that's one thing we were told that is not true. It may have been a mistake, and that's very possible. Secondly, Mr. Kirby got up and stated that it was an overstatement of the number of people who are impacted by this. Well, my feeling is, if one retiree is impacted by this, that's too many. The retirees of this town retired thinking that they were going to have this coverage. And to change this in midstream is absolutely unfair. It's unfair just to do that. Also, the point keeps getting brought up that the retirees that have chosen HMO Blue can go out of state, can go to Florida, can go to California. That's true. I'm sorry. The retirees that have chosen the Medicare, Medicaid can go out of state, Florida, Hawaii, California. That's true. But the retirees who choose the HMO Blue cannot do it. And they know that. They know that when they take it. So don't put it up there as a plus. If they want that, they would do that. Now, I'm not going to stand here all night. Everybody knows how I feel on this. But what I ask you is this. And I have no problems giving money to certain departments in town. But do not balance a budget on the backs of some people who are 70, 80, and 90 years old that cannot make up this loss that they're going to encounter. Now, I'm getting to the age where I'm going to have to change over because I am a former Reading employee, and I have to change over. It's going to cost me approximately $3,000 because what nobody's told you is a lot of the medications are not covered, that are now covered under HMO Blue. Thank you. I ask you to vote this down.
Bernie.
And Bernier again, I just wanted to inform the town meeting that there is an Article 23 that states that the people that are retiring this year would all have to move over to Medicare and Medicaid. Don't pick on the elderly, the 80 and the 90-year-olds. Vote this down and vote for 23 if you want to.
Marty Johnson, 9 Oscar Way. This is very ugly. I understand and I respect the work of the Finance Committee in trying to save money for the town. I also respect the retirees and understand wholeheartedly a limited income person trying to cover health care today. It's very near and dear to my heart. Is there an opportunity for compromise? This is a question I have with the Finance Committee. We tend to have an opportunity to save, I think you said $165,000, and we're talking about, I'm going to use round numbers, approximately $2,000 for 17 to 23 people, let's call that 20 people. Could we pay the increased premiums for these people for 3 to 5 years, giving them an opportunity to make adjustments in their income and their budgets and plans? And I understand that would require an amendment to the article, but is that an option for us? Can we compromise on this?
To answer your question, unfortunately,